A caregiver that I was talking to said that her mom was supposed to go home today. The discharge papers were signed, the rehab staff all said their goodbyes, and the wheelchair was rolled to her car. And she was so happy to have her mom home. And it was only when they got home that the reality of the situation hit because there was no walker, no nurse, no shower chair, and no updated medication list. Just a frail little woman looking at her daughter who was holding back all of her tears and a stack of papers with phone numbers that all led to voicemails. This daughter told me later, I thought that I did everything right. I visited every single day. I talked to every single nurse and I asked what I thought were the right questions and did everything that I think I could. But she said she felt like she was blindsided. And she's not alone in feeling this because even the most involved, organized, and caring families get caught off guard when a hospital, a rehab, or an assisted living move happen overnight. And it's not because they're unprepared or inattentive. It's because the system isn't designed to include them. And today, I'd like to break down why families get blindsided by care transitions and how you can start to recognize those gaps before they happen. Because when you understand why this happens, you can finally start to stay one step ahead. Because the system uses the phrase smooth transition in healthcare all the time, and it sounds mostly reassuring, right? But here's the truth. Most smooth transitions are smooth on paper only. And in reality, what they actually look like is a relay race, but there's no handoff baton. Because the hospital assumes that the rehab will handle it, the rehab assumes that the home health care nurse will handle it, and the home health care, well, they assume that the family already knows what they're supposed to be doing. But somewhere in that chain, communication breaks down, and it's the caregiver who ends up catching all of the heat. And hospitals are under this constant pressure to discharge quickly. Beds are needed, insurance clocks are ticking, and that means that discharge planning often starts too late or moves too fast for anyone to stay in the loop. And when your loved one leaves, the team moves on to the next patient. And that's not because they don't care, but because the system doesn't slow down long enough to coordinate true continuity of care. And this fragmented care gets you fragmented medication lists that don't match, therapy plans that disappear, specialists who never get the memo from point A to point B. And who fills in those gaps? You do. And when the system runs on speed, families get left in the dust. They're expected to manage the medical care without medical training and to coordinate all those services without any support. And that's not neglect. That's the design. It's a system gap that most people don't even know exists until it happens to them. Another reason that families get so blindsided is because they assume someone else is handling it. Before discharge, the nurse came in and said home care would be ordered. The social worker mentioned that there'd be a follow-up call. And the rehab therapist said the primary care physician, well, they'll take care of it. And the primary care doctor is completely left out of the loop because they have none of the discharge paperwork. And the sticky thing about it is the communication is lacking because every single one of those people work in a different system that has different rules. And that's why when you get home after any discharge, the phone isn't ringing, the walker doesn't show up, and the medications, they never arrive. And you're already exhausted from all of the hospital back and forthing, and you're left to piece together this plan. You're calling the pharmacies, you're calling the hospital, you're calling the rehab, and you're chasing all of this paperwork and trying to figure out who actually knows what is going on. And what I found is that most families assume there's a quarterback or somebody who's overseeing the whole big picture. But in most cases, this isn't true. There is no one actually doing all of that. The hospitalist is not going to follow your person home, and the rehab doctor isn't communicating with your PCP. And the primary care, like I said, they may not even get your discharge paperwork for weeks unless you have that whole big bound copy right in your hands. And so, what I found is that caregivers are falling into this huge gap without a playbook, and they don't know how to navigate around it. And that's why when I meet caregivers, they tell me I had no idea how much coordination was involved until I was in the thick of it. And it's not their failure, it's the system's silence. Now, let's just talk about that emotional side for just a hot second. Because when a transition happens from hospital to rehab or rehab to home, caregivers often describe this as being thrown into the deep end without a life jacket. There's confusion, there's guilt, there's even shame. Like they should have known better. But honestly, how could you? Because the truth is, most caregivers are never taught what's coming next. They're told what happened in the hospital or what happened in rehab, but not what's going to happen at home. And that's when the panic really starts to set in because it's now 8 o'clock at night, mom's home, the nurse didn't show up to your house, you didn't realize that you didn't have all the equipment, the supplies, or the information that you needed. And that's not you being disorganized. That's you standing in the gap that nobody warned you was coming. And after 25 years in healthcare, I can tell you this. Every professional you meet, the nurse, the doctor, the therapist, they all care so deeply, but they each work in a silo, and those silos protect the system and not the family. It's faster, it's cheaper, but it's also why families like the daughter I told you about end up standing at home with no walker, no nurse, and no idea what happens next. And that moment isn't a one-time error. It's the byproduct of a healthcare model that treats discharges as if they're the finish line instead of a handoff. And until that changes, caregivers like yourself are going to keep falling into those gaps until we teach you how to recognize when those gaps are coming. So if you're a caregiver and your person is getting ready to change environments, the hospital to rehab, rehab to home, home to an assisted living, or any of the like, let me leave you with a few things to start thinking about before your next transition happens. First, ask early. Don't wait for discharge day. Start asking about equipment, follow-up appointments, and medication lists the minute someone mentions that your person is going home. Second, get names, not titles. Somebody telling you that the nurse will call you isn't good enough. Write down who, first name, last name, and contact number, as well as agency. Third, make sure you're documenting everything. Even if you think it's something small, every instruction, every handoff, every phone number, they're all going to be important. I feel like discharges often happen on Fridays when no one answers their phone. So I want you to start building a plan that includes the what if. What if it's the weekend? What am I going to do? And lastly, trust your gut. If something feels off, it probably is. Ask the question again. Even if it feels uncomfortable, ask until you feel clear. Every week, I meet with families who did everything right and still feel overwhelmed because no one told them where the real gaps are. This is why so many families fall into the gaps and exactly why I created the Caregiver Gap Report. It walks you through the most common points where the system drops the ball and helps you build a plan so you're never blindsided again. If you've ever had that sinking feeling that something's missing, or you've lived through a discharge that left you scrambling at the last minute, this is your chance to change that story. Because when you understand the system, you can finally start working with it instead of being crushed by it. And you don't have to have every single answer. You just have to know what question to ask. Make sure you grab a copy of the Caregiver Gap Report and that you never have to go through another transition alone, because the system may not be built for you, but your care plan can be. And until next week, I'll be here sharing for you while you're caring for them. See you next week.